On the profile interview segment this week, I'll be speaking with the Secretary General of the Medical and Health Workers Union of Nigeria. He brought us up to speed on how workers in the sector are faring, the need for the federal government to stop the idea of concessioning of public hospitals, and also the reason why there's massive brain drain in the healthcare sector. We will be right back. It's good to have you on the program.
Thank you very much, and you're welcome.
A lot is happening in the health care sector. Can you bring us up to speed on what the Medical and Health Workers Union position is when it comes to the issue of hospital concession, which the federal government is looking into recently?
Let me start by saying Medical and Health Workers Union of Nigeria is in strong disagreement with the federal government in respect of tactical privatization of health facilities in the country. You will agree with me that the only thing the common man is benefiting from government nowadays is the healthcare delivery. And in as much as federal government decided to privatize these health facilities, I can tell you it will be above the level of common man in this country. Rider to it, there is a teaching hospital here in Abuja, Gwagwalada Teaching Hospital, which federal government attempted to privatize it. I can say it is now on semi-privatization level. If you go to that health facility trying to access healthcare delivery, you can spend not less than 15,000 naira just for you to access your record, meaning to get a prescription card before even going to see a doctor, talk less of drugs prescription, talk less of other medical attentions. So I think this is a typical example, and this is a typical things that you will agree with me that if government decided to privatize these health facilities, healthcare delivery to a common man will be a history, and it will be above the average Nigerians. So I think Medical and Health Workers Union is doing a lot to kick against this attempted as well as ill-minded initiative by the federal government.
Okay, with this development, how would this affect Nigerian workers apart from Nigerians generally? How would it affect the workspace? If at all this privatization comes is successful, how would this affect the average Nigerian healthcare worker, if I may ask?
Let me be honest with you, Sharon. Nowadays, if you go to all our health facilities in the country, we even lack manpower. Manpower is in a very serious dilemma. You can see a doctor attending 250 patients per day nowadays. If you go to that issue of concession or privatization, I believe in every facilities that have 3 medical doctors, they will slash it to be 1 medical doctor. In a pharmacy where you will see 3 pharmacists working, it will be a single pharmacy. In a laboratory where they have 3 medical laboratory scientists, they will end up having even technician. So if you take a look of the even manpower, it will drastically go down, and it will affect the healthcare delivery system in the country.
Talking about manpower, right now, I don't know if I should use the term, there is a jackpot syndrome. Everybody is running away from the country to seek greener pasture. And the healthcare sector seems to be what is very attractive for everyone that is maybe a nurse, a lab technician, just anything that has to do with the body. You are welcome to Europe or maybe Canada. And I am aware with my interactions with Nigerian workers that we have some states whereby you don't even have doctors. We have some few doctors trying to manage from one teaching hospital to another within a state. It's getting to that point whereby we don't even have some specialists in a particular area in some certain states in the country. As the Secretary General of this union, how would you react to this? What does the government need to put in place to ensure that we retain the best brains? Because the best brains, of course, are already looking out of the country.
Well, I think it's a very good observation you raised. And in response to that, one, government should ensure that adequate provision of facilities or equipments are provided in almost all our hospitals, because you can see a very befitting hospital structure without equipments. So most of our health professionals are running away from the country because there is no equipments. Two, even the package. Yeah, if you go, not even in Euro or developed country, go to Ghana, just Ghana, for example. I was in Ghana just 2 days ago. I was interacting with my colleague in Ghana, who is a consultant ophthalmologist. If you take a look of his salary compared to here in Nigeria, there is a variation of over 2.3 million to his colleague in Nigeria. So I believe if government will try to probably adjust the package, it will help a lot to reducing our people to be going abroad for maybe practice. Then number two, government should try as much as it can to avoid desegregation among the health care professionals, because you can agree with me, there are almost 1,000 numbers of nurses professionals who run out from this country to other countries just because they have a welfare package. Two, there is no segregation, they are working as a team. Yeah, it is in our slogan that health work is a teamwork. Everybody is considered to be significant and important. So if you go to that countries, it will be difficult for you to even differentiate between medical doctor and the nurse because they are working collectively as a team. Then number four, government should try as much as they can to do away with thinking maybe they will generate money from health industry. Because if you go to developed countries, government is paying a lot of money without thinking on how it will retrieve that money back. But in nowadays country, in nowadays pattern in our country, government is now trying to come up with an initiative that even the health system will be sell out to our citizens, which I believe it will not augur well, not only to the current administration, but to the well-meaning Nigerians.
Okay, so moving forward, what more can be done to improve the healthcare sector? We agree that the package is actually poor. I know that the health workers have their demands. They've suspended their industrial action at many times. But right now, has there been any engagement with government in terms of ensuring that the welfare of workers in the medical and health sector is being prioritized?
I'm sorry to use this word. Government, particularly the Federal Ministry of Health and the Federal Ministry of Labor, are not sincere to us, and they are not justice to us. It will be unfortunate to inform you that we suspended our strike without any tentative responses from the government. We just have the interests of common man in our heart. That's why we decided to suspend that industrial action. As a health professional, we believe our first priority is patient. The second priority is patient. Even the third priority is patient. So that's why we decided to suspend that industrial action. But if you are to think of the commitment from the government, I can tell you it's very disappointing and it's very worrisome. So government should do everything possibly, more especially to these two ministries, because to me, they are Ministry of Doctors. They don't consider other health professionals as even health workers. What they are more doing is they are giving more priority, they are more concerned to the medical doctors, which is quite and very, very unfortunate compared to other developed countries. Let me give you this context of the United States of America. The chief surgeon of the United States of America currently is a nurse. They do away with professional differences. So I think Nigeria must start somewhere to address this issue of professional barriers or professional discrepancies, in as much as we wanted to have a very effective, efficient, and affordable health system in Nigeria.
Okay. We understand that the patient to medical personnel ratio is actually not encouraging. We have more health workers attending to large number of patients, and the infrastructure isn't there. What will be your message to relevant stakeholders in terms of probably employing more people into the system, paying them well, and also ensuring that we have up-to-date medical facilities so that workers can perform efficiently?
Sharon, if you go to it's a challenge. If you go to each and every state in the country, you can see they have 2, 3 teaching hospitals. It's a structure without manpower. What the essence of that structures? Let them maintain the one they have, and let them provide enough manpower, let them provide equipment, let them provide drugs and all other medical equipment and items on that facilities. Then I think number 2, yeah, we must try as much as we can collectively with our sister union, meaning more especially the family of Jehesu, to come in a strong term jointly to address this issue of inadequate manpower, more especially in our health facilities, not only at the federal government, even at the state level, even at the local government level. We have that challenges. You can go to the primary health center or health clinic at a local government, you will see only one community health officer handling a patient of almost 250 number, which is unaffordable. So I think government should try as much as it can, as I said, to improve the manpower. We have enough adequate qualified health professionals who are yet to be employed, because each and every day they will tell you they have an embargo of employment. Those cadres are there, those professionals are there, but some are even going to run services on casual basis, some on even volunteer. So I think government should try as much as it can to ensure it provide adequate manpower to our health facilities. If they do so, it will address this issue of health challenges in our country.
Thank you very much for your time.
Thank you very much. You are welcome. My pleasure to have you.
And that's all we can take on today's edition of the program. Join us next week for a fresh edition of the show. I am Sharon Ijason. Thanks for watching, and remember that labor creates wealth.